Hi, and welcome to today's video on how to get medical work experience, which is key to stand out in medical school applications. I'm Dr. Sarah Nichols, and today I'm going to guide you through step by step on how to secure work experience placements and make the most out of them. In this video, we'll talk about how to find placements through the NHS, how to write emails of introduction that will make a great first impression, when to start looking for opportunities and why timing is everything, the importance of DBS checks and why they're necessary for your placements. And before we dive in, if you're interested in a more immersive experience, be sure to check out Medic Mind's Medicine Work Experience program. Stay tuned in to hear the code for how you can get £100 off and get hands-on experience with emergency simulations, clinical skills like suturing, and a mock MMI circuit. If you like this video, don't forget to hit that like button, subscribe, and leave your thoughts in the comments. So first of all, let's talk about work experience through the NHS. So where do you start when it comes to finding work experience? One of the best places to begin is through the NHS. The NHS is the UK's largest healthcare provider, and they offer a ton of opportunities for aspiring medics like you. A great place to start is through contacting your local NHS Trust. NHS Trusts manage hospitals and healthcare services in your area, and they often offer shadowing programs or work experience for young people interested in medicine. You can find contact details for local NHS Trusts on their websites. Reach out to university hospital trusts. University hospitals usually have clinical placements or shadowing programs available for students looking to gain insight into the medical field. University hospitals are also great because they often provide exposure to a wide range of specialities. Here's a pro tip. Start by researching the opportunities available on the NHS website. They have specific pages dedicated to work experience, shadowing, and internships. And if you're not finding something right away, don't get discouraged. Keep reaching out. When contacting the NHS for placements, it's helpful to be persistent and professional. If they don't have anything available right now, don't hesitate to check back after a few weeks or months. Timing is key here. For medical work experience, you don't just have to go through the NHS. There are plenty of other opportunities which will allow you to portray an insight into medicine and a commitment to quality patient care, such as volunteering. You can volunteer at hospitals, GP surgeries, or even local charity shops. Volunteering in environments where you interact with patients like hospices or care homes will allow you to develop empathy and communication skills. Private practices. Sometimes smaller practices offer a more intimate learning environment where you can get more personal time with the staff. Plus, these can be a great option if hospital placements are hard to come by. Specialised placements. You could also look for placements in areas like mental health, physiotherapy, or optometry. Medical schools love applicants who have a wide range of experiences. Another option is research. Participating in medical research is another way to gain experience. This can give you a behind-the-scenes look at the scientific aspects of medicine and improve your understanding of the medical field. Section 2, writing effective emails of introduction. So once you've identified potential placements, writing a strong email is your next step. As a 16 to 18-year-old aspiring medic, you might feel like a bit of a novice, but don't worry, you're already showing initiative by reaching out. Here's how to make sure your email stands out. Subject line. Be clear about why you're reaching out. Something simple like work experience inquiry and then your name, or shadowing opportunity and then your name. These both work great. Start with a polite greeting as an introduction. So dear, title and name works well if you know the person's name, or dear sir or madam if you don't. Then go on to say who you are. Briefly explain who you are. So mention your age, what you're studying, for example, GCSEs or A-levels, and why you're interested in medicine. Show your enthusiasm here. Next, show why you're interested in that placement. Research the hospital or practice and show why you specifically want to work there. Do they specialise in an area that you're passionate about? Are you interested in the work that they do? Then go on to why they should give you a chance. Mention how eager you are to learn and your commitment to gaining experience in medicine. Then attachment. Always add your personal details to make it easy for the recipient to reach out to you, including your full name, your date of birth, and possibly also your phone number. It could be a good idea to attach a CV. Remember, your email is your first impression, so make sure it's polite, clear, and professional. Show them that you've done your homework and that you're genuinely eager to gain experience. And just something to note, when seeking GP work experience as a medical student, it's generally advisable not to shadow at your own GP practice for several reasons. Confidentiality issues. If you're familiar with some of the patients, there could be confidentiality concerns. Medical ethics require that patient confidentiality is strictly maintained, and your personal connection with the patients might make it difficult to ensure this, even if you're not directly involved in their care. Also, conflict of interest. Having a personal relationship with the practice may create the appearance of a conflict of interest. It's important for both you and the patients to feel that the experience is professional, unbiased, and focused solely on your learning. Learning experience. Visiting a different GP practice allows you to gain exposure to a different environment and a different patient population. You'll get to see how other GPs approach their work, deal with different patient cases, and perhaps work with different specialities or medical teams. Section 3. When to start looking for experience. It's never too early to start looking for work experience. Ideally, you want to begin reaching out at least 6 months before you want to start your placement. Many placements, especially in hospitals, may have waiting lists or deadlines. So the sooner you start looking, the better. If you're aiming for a placement during the summer holidays, you should begin emailing hospitals or clinics as early as December or January. That way you'll secure a spot early on, and you won't be scrambling at the last minute. Some placements also have rolling deadlines, meaning you can apply throughout the year, but others, like summer internships, often have fixed deadlines. So make sure you're aware of this before sending out your applications. And here's a pro tip. Create a timeline and set reminders for when to follow up with any placements you've applied for. It helps to stay organised and proactive. Section 4. DBS checks. Now, DBS checks are mainly relevant if you're over the age of 18. This is a criminal background check that ensures that you're fit to work with vulnerable groups like patients. DBS checks are an important requirement for most hospitals or care settings. Don't worry, if you're under 18, your DBS check may be arranged by the organisation you're applying to, but it's always good to check first. Some hospitals and clinics will help facilitate the DBS check process for you, but some may require you to do it yourself. If you're applying to more private settings like GP practices, a DBS check may not be required, but it is worth double checking. And here's a helpful tip. Start by asking the placement whether they require a DBS check and whether they will help facilitate that. It's always a good idea to ensure that you're on top of the admin side of things. Now, do you remember that code that I mentioned earlier in the video? Well, here it is. You can use the code SUMMER100 at checkout. You can find the link in the description. To sum up, securing medical work experience is all about research, professional communication, and starting early. Here's a quick recap of everything we've talked about. Firstly, reach out to your local NHS Trust or university hospitals for placements. Write strong, professional emails of introduction. Start looking for placements at least 6 months in advance. And be aware of the DBS check requirements. And of course, don't forget about Medic Mind's medicine work experience for an immersive experience in clinical skills, mock interviews, and more. You can use the code SUMMER100 for £100 off your booking. And a reminder for you, getting work experience is one of the best ways to show medical schools that you are dedicated, organised, and passionate about your future in medicine. And it will be invaluable when you get to writing your personal statement and going to interviews. So if you found this video helpful, don't forget to like, subscribe, and share it with other aspiring medics. Let us know in the comments what tips you found helpful, or if you have any questions about securing work experience. Best of luck. See you in the next video.